Welcome to Podocyte Talk. In today's episode, we're diving into 3 studies that bring new insights into the nephrology field. We'll explore a trial on the effects of Semaglutide in CKD patients without diabetes, a study on immunosuppressive therapy in primary membranous nephropathy, and a large-scale analysis of hyperkalemia incidence in non-dialysis CKD patients. Let's dive into the details and see what these findings mean for kidney care. Semaglutide in patients with CKD without diabetes. Semaglutide, typically used for managing type 2 diabetes, was tested in a study involving CKD patients with overweight or obesity who did not have diabetes. The trial involved 101 participants who were randomized to receive either Semaglutide, 2.4 milligrams per week, or a placebo for 24 weeks. The primary outcome was the reduction in albuminuria, a key marker of kidney disease. The results showed that Semaglutide significantly reduced albuminuria compared to placebo, indicating potential benefits for kidney health beyond its established role in diabetes care. However, gastrointestinal side effects were more common in the Semaglutide group. This suggests Semaglutide could be a valuable option for managing CKD in overweight or obese patients, even in the absence of diabetes. Immunosuppressive therapy in primary membranous nephropathy. The second study focused on real-world outcomes of immunosuppressive therapy in patients with primary membranous nephropathy, a kidney condition known for its risk of progression. Conducted in China, this retrospective study included 464 primary membranous nephropathy patients, treated either with immunosuppressive or conservative therapy. The analysis found that Shu immunosuppressive therapy significantly improved renal outcomes, especially in patients at moderate and high risk of progression. The study also highlighted key factors influencing outcomes, such as age, blood pressure, and cholesterol levels, emphasizing the need for tailored treatment approaches. This research supports the role of immunosuppressive therapy in managing primary membranous nephropathy and provides guidance for individualized care. Hyperkalemia incidence in patients with non-dialysis CKD. This retrospective cohort study analyzed 1,771,900 patients with stage 1 to 4 CKD from the U.S. Optum de-identified electronic health records database. The study aimed to estimate the incidence of hyperkalemia in CKD patients and examined how factors like urinary albumin-creatinine ratio, UACR, and estimated glomerular filtration rate, EGFR, influence this risk. The results showed that over a mean follow-up of 3.9 years, the incidence of hyperkalemia was 3.37 events per 100 person-years. Higher rates of hyperkalemia were observed in patients with increased UACR and lower EGFR. For instance, those with UACR 3500 TANE had incidence rates as high as 19.1 events per 100 person-years. Higher risks were also noted in patients with type 2 diabetes mellitus, T2DMs, heart failure, and those on steroidal mineralocorticoid receptor antagonists, SMRAs. This study emphasizes the importance of regular serum potassium and UACR monitoring in CKD patients, especially those at higher risk, to better manage and reduce the likelihood of hyperkalemia. Join us on Podocyte Talk as we continue to bring you the latest insights into kidney disease research and treatment. Check the description for links to the studies discussed in this episode, and stay tuned for more insights into kidney disease research and clinical innovations. Tune in now to stay informed.